Welcome to Community Health TV.
Poisoning is the harmful effect that occurs when too much of a substance has been taken. A poison can be any substance that is harmful to the body. It can be swallowed, inhaled, injected, or absorbed through the skin. Acute poisoning is exposure to a poison on one occasion or during a short period of time. Symptoms develop in close relation to the degree of exposure. Absorption of a poison is necessary for systemic poisoning, that is, in the blood throughout the body. In contrast, substances that destroy tissue but do not absorb, such as lye, are classified as corrosives rather than poisons. Furthermore, in the medical sense, toxicity and poisoning can be caused by less dangerous substances than those legally classified as a poison. Toxicology is the study and practice of the symptoms, mechanisms, diagnosis, and treatment of poisoning. Chronic poisoning is long-term repeated or continuous exposure to a poison where symptoms do not occur immediately or after each exposure. The patient gradually becomes ill, or becomes ill after a long latent period. Chronic poisoning most commonly occurs following exposure to poisons that bioaccumulate, or are biomagnified, such as mercury, gadolinium, and lead. Contact or absorption of poisons can cause rapid death or impairment. Agents that act on the nervous system can paralyze in seconds or less, and include both biologically derived neurotoxins and so-called nerve gases, which may be synthesized for warfare or industry. Exposure to radioactive substances can produce radiation poisoning, an unrelated phenomenon. Management. Initial management for all poisonings includes ensuring adequate cardiopulmonary function and providing treatment for any symptoms such as seizures, shock, and pain. Injected poisons, e.g., from the sting of animals, can be treated by binding the affected body part with a pressure bandage and placing the affected body part in hot water with a temperature of 50 degrees Celsius. The pressure bandage prevents the poison being pumped throughout the body, and the hot water breaks it down. This treatment, however, only works with poisons composed of protein molecules. In the majority of poisonings, the mainstay of management is providing supportive care for the patient, i.e., treating the symptoms rather than the poison. Decontamination. Treatment of a recently ingested poison may involve gastric decontamination to decrease absorption. Gastric decontamination can involve activated charcoal, gastric lavage, whole bowel irrigation, or nasogastric aspiration. Routine use of emetics, syrup of ipecac, cathartics, or laxatives are no longer recommended. Activated charcoal is the treatment of choice to prevent poison absorption. It is usually administered when the patient is in the emergency room or by a trained emergency healthcare provider such as a paramedic or EMT. However, charcoal is ineffective against metals such as sodium, potassium, and lithium, and alcohols and glycols. It is also not recommended for ingestion of corrosive chemicals such as acids and alkalis. Cathartics were postulated to decrease absorption by increasing the expulsion of the poison from the gastrointestinal tract. There are two types of cathartics used in poisoned patients: saline cathartics, sodium sulfate, magnesium citrate, magnesium sulfate, and saccharide cathartics, sorbitol. Emesis is no longer recommended in poisoning situations, because vomiting is ineffective at removing poisons. Gastric lavage, commonly known as a stomach pump, is the insertion of a tube into the stomach, followed by administration of water or saline down the tube. The liquid is then removed along with the contents of the stomach. Lavage has been used for many years as a common treatment for poisoned patients. However, a recent review of the procedure in poisoning suggests no benefit. It is still sometimes used if it can be performed within 1 hour of ingestion and the exposure is potentially life-threatening. Nasogastric aspiration involves the placement of a tube via the nose down into the stomach. The stomach contents are then removed by suction. This procedure is mainly used for liquid ingestions where activated charcoal is ineffective, e.g. ethylene glycol poisoning. Whole bowel irrigation cleanses the bowel. This is achieved by giving the patient large amounts of a polyethylene glycol solution. The osmotically balanced polyethylene glycol solution is not absorbed into the body, having the effect of flushing out the entire gastrointestinal tract. Its major uses are to treat ingestion of sustained-release drugs, toxins not absorbed by activated charcoal, e.g., lithium, iron, and for removal of ingested drug packets, body packing, smuggling. Patients poisoning in the community requires an urgent attention of quick intervention by accessing the community health center in your community. Kindly support me by subscribing, liking, and sharing.
Don't forget to subscribe.